share this. Send this to my mom.
I remember when I was calling her, did she not already brought her out?
I don't know. Depends on the day.
Yeah.
Some days she's like, oh, you became a doctor. I'm so proud. Some days she's like, some days I'm like, Mom, I can't prove my bills. Can I have $100? He just walked away. That's my money more time. I've prepared for money more time since I started taking seriously.
But I was like, this literally not with an explanation here besides that.
I basically can't afford it.
Stick arms and
I have to
something
out of the
wrong.
pay for a flight ticket. I'm sorry.
You be right in the middle there. And you're lucky you block her head. You don't want to do that.
Sorry.
But you live in infamy.
My response. Today is the day the world will know your face.
I'm like right here. I'm right. But she's gonna stand right in front of me.
Yeah.
Maybe I'll move. I'll take my window.
You gotta find your window. Yes, exactly. Exactly.
Feels like I'm just peeking out like above her.
Oh, nothing. Just getting my clothes on. I actually don't think I'm going to be in the shop. Just kidding.
How is it?
Well, I think I'm too tall. It's just going to be my neck.
It will be like up to here. Have you seen that CDC thing they put out about all the beards that don't work with like a respirator?
Oh, yeah. I whenever I have to go in the droplet room, I have to go
Wear like a hood. Yeah. They were so funny though. The names of all of them. The Fu Manchu does work.
But I've been so committed to this effort that I'm not willing to be for this.
Committed to the effort of growing.
Yeah.
You might birth them both.
It's been a lifelong project.
He's like, it wasn't easy.
Guys missing school for this?
Yes.
You're good. Can I get a picture of your mom? Your mom would like a picture of her. But she needs you to smile. We do that?
We gotta play it cool though. It's absurd.
Never know who. Do you know?
I think it's Barack Obama. I'm not sure though.
Plus mine.
I guess we can't tell jokes during the press conference. I don't want the world to see me cracking up. Oh, you were the bear?
I was the bear that had to sit down.
Oh my gosh. Where does the costume even at? Is it like
No,
stored?
Margarita gave it to me.
That's incredible.
And here's the thing, I've been in a mascot bear suit before, strangely not that one. But
gonna say,
when I worked at the National Zoo, I was in the panda costume.
ABC?
Yeah, yeah.
Oh,
And it was cool, but I would tell you, that bear costume is just mentally.
How did
Like,
you
I've been a panda, and the panda conventions, like, I had to dance in a snowboard as a panda during zoo legs. And that I did. And let me tell you how hot that bear is to give you.
Honestly, I've been around a lot of people who are having really accomplishments. Having danced in a panda suit and being inside a snowboard and sea lights is one of the coolest things I've ever heard.
I mean, I did get paid for it too, so it was pretty
What was your actual job at this?
I was in the education department, the education department intern throughout my year, and then the summer after my senior year.
That is so cool.
I was a camp counselor when I was younger, so when I was just college part-time, I think it was really fun. Yeah. veterinarian at the time.
Well, you kind of are.
I kind of am, yeah.
Kids are.
So many guys. We just do so much. So that when those speakers come, just like what could actually see your infection.
They get put down.
Yeah. Like they don't just go to the vet for like
Well, child check.
so it's just like sad.
Is it, do pets get like well checks?
For the first, like when you bring a new dog, just like get a baseline.
There's no like routine schedule, like 2 months, 4 months, 6 months.
There's like typically they recommend bringing them once a year to like check like for like worms and vaccines and that kind of thing, but like not at all. Which I mean, unless you have like pet insurance. And I mean we have all the technology, right? Like you can keep a dog on insulin and then you can keep a dog with diabetes live like forever. But don't. It sounds expensive. So just not a bummer.
My dog had that insurance and it's like
See, like that would be if I had all pet owners who had the ability to do that.
we had to get a monthly shot every day.
Yeah, and that's like such devotion, which like if you do it is incredible and so loving. But like I understand not having the ability. So like if you really adore your dog.
My mom was like, absolutely not. It's not like that.
What kind of dog? What kind of dog?
It was a mixture of both.
Oh no, so cute.
Very,
Like scary, but in a small way. You know, so not scary.
Yeah, they were
my wife dream when I grew up is to have this. She would really gigantic, terrifying dogs that had like actual chains and issues. Kind of like junkyard dogs.
But like, are they nice actually?
Maybe not. You know how in the movies it's like there's junkyard dogs that are like, that wasn't happening. It's not moving, they'd be nice to me. But they'd be mean to other people.
I had a Jack Russell Terrier when I was in Chicago, and a construction worker was making rude remarks at me, and a Jack Russell Terrier bit.
I have a Jack Russell and Chihuahua.
I bet it's insane. So you think my Jack Russell was insane, but it's just and it's like it's just
What's a good big
German Shepherd.
If you look at it too fast, you might think it's a small bear.
Husky. There's a few times where I've seen, because like when I worked in Navajo Nation, they mix German Shepherds with wolves, and there's like half in the house. And there's people walking like literal wolves around Navajo Nation.
Like actual genetic wolves.
Yeah, that's hot.
Wow.
That's a wolf though that you have on a leash. So let me help you with that.
I don't like little dogs.
I mean, those were not little dogs.
I like dogs that are scary.
It was half a German Shepherd. Being a German Shepherd is not a gossip dog.
Yeah, they're cool dogs because they're more like Belgian Malinois. The dogs that like they're easy because they're canines. Have you ever worked with Juan Medico?
Love him.
Ask him to tell you the story about how he resuscitated a dog with his mouth.
Best story.
His dog was one of the boys had puppies. These came out bleeding. Basically NRP. And he literally did he provided PPD with his mouth and the dog's life. Yes. The horse story? Oh, no. Yeah. So I was going to tell you the story about when he was an intern and she was a senior. She had a patient who was dying of disease. And the patients weren't able to ride a horse. So she got her personal horse from her house. Brought her personal horse from her house, brought it to the hospital, and then made Paul, who at that time was her husband, just her intern, participated in this scheme to get a patient on all precautions outside and downstairs. Onto a horse.
Are they like
said he was like terrified, but like he didn't feel like he was on fire because we have this president that's like.
I remember this, yeah, and then like they're like, where is the CF patient?
Like they put her. Oh, here's the story. Here's the cool part of the story. She made him quit the patient's oxygen tank or something like one of the things that the patient needed to breathe in his book bag to like smuggle it downstairs.
Like, what is happening? Like, I bet, you know what I bet though? It wasn't that he was younger and she was a senior at that time. It was that he had a crush on her.
Yeah. Their life is amazing. They have horses, they have dogs, and they have 16 with their hair. What time do they live here? Is that far?
It's like an hour and a half.
I would say he goes early enough in the morning, probably an hour, but yes. If he goes, try to go like,
All right, campaign for tobacco-free celebrities here.
Come on, everybody coming in. Rich, just begin. Look, I just want to thank the speaker for, really being the driving force to bringing this bill up today. And it's all about kids, right? We know we have this youth vaping epidemic, tobacco epidemic, and she more than anybody, I think, cares about kids. She always, I think I can say she always says, well, she doesn't say it, but I believe she's a mom before she's anything else. And that's why she's, and a grandmother. Simply, we have this epidemic. It's multifaceted. And it's the big tobacco that has become totally irresponsible in running ads and trying to get kids hooked on tobacco, primarily vaping through flavors, but in other ways as well. And we have to do something about it. So basically what the bill does is to ban flavors. It says that there's no more online sales. And it deems e-cigarettes a tobacco product, which means they have to come under the same marketing, advertising restrictions, and that they cannot market or advertise to kids. We think this is a comprehensive approach that will actually deal with this youth tobacco epidemic. And I appreciate the support, obviously, of everyone's here, but particularly those groups that are behind us that have been so supportive in bringing forth why this is important. So I'll leave it with that and introduce the number one mom, or she'll say grandmom, I guess.
Thank you very much, Mr. Chairman. I know you have to go to the floor, and I'll be up there shortly. Thank you for taking the lead in this, to you and Chairman Richie Neal, the Ways and Means Committee. We're yielding to you momentarily, and of course, to the chair of the Congressional Black Caucus, Karen Bass. Yes, when people ask me what are the three most important issues facing the Congress, now for 30 years, I've always said the same thing. Our children, our children, our children. Their health, their education, the economic security of their families, a clean, safe environment in which they can thrive, a world in peace in which they can reach their fulfillment. Do you see what is happening with this appeal to children, trying to addict them to tobacco as a real assault on the health and well-being of America's children and America's family? Today, Democrats are taking strong action to protect America's children as we pass H.R. 2339, legislation to confront the growing youth tobacco crisis in our nation. The growing youth tobacco crisis in our nation. I thank Chairman Pallone of the Energy and Commerce Committee, as I did, Mr. Neal, the CBC Chair Karen Bass, and all who have worked to advance this bill, including two of our physicians in the Congress, of whom we're very proud, Congressman, doctor, I guess we can call many things, Raul Ruiz, an articulate spokesperson on this subject, and you'll hear that for yourselves, and Dr. Kim Schreier, a pediatrician, a new member of Congress, who's been a really important force in what we are doing today. And I'm honored to welcome Abby Hefford, Dr. Laurie Felucci, and all outside guests who are here to share their stories and raise the drumbeat on behalf of America's children, our children, our children. Others will talk about what the bill does, and if they don't, I will come back up here. But I do want to thank also the NAACP, thank you for being here, the National Medical Association, and so many others, the National Nurses, African American Nurses Association, so many others who have come out in strong support for this legislation, actually to help shape it. We have our what they have said. I don't know if you've seen their ad, but what they have said. For decades, Big Tobacco has targeted African Americans with menthol cigarettes with devastating consequences. Menthol cigarettes have addicted generations of African Americans, resulting in high death rates from lung cancer, heart disease, stroke, and other smoking-related illnesses. And they go on to say, support H.R. 2339 to protect our kids. Again, over 75 organizations have joined them in this resolution. We must listen to them and pass this bill. And aren't we blessed to have the future standing right here with us this morning? The Campaign for Tobacco-Free Kids. They're our VIPs. Welcome. Give us a wave. Give us a wave. So good. With that, I'm very pleased to yield to the distinguished chair of the Ways and Means Committee and thank him for his leadership on this important issue as well. Mr. Neal.
Thanks, Madam Speaker, and thanks to Frank Pallone and Karen and the other members that are here as well. We're upholding a Democratic promise today as it relates to health care in America. Not only will this legislation reduce youth tobacco and nicotine use, it also includes a Ways and Means provision that will make it possible to lower costs and increase access to critical treatments and preventive care. Studies show that excise taxes reduce both adult and underage smoking. So will this bill. We've proposed to establish a federal excise tax on nicotine in vaping products to make sure that they are treated the same as the nicotine in combustible cigarettes. With the savings from that tax, we will provide financial protection to Medicare beneficiaries undergoing important colorectal cancer screenings. This is a common-sense policy that would reduce out-of-pocket costs for seniors receiving highly effective preventive care. Our legislation also allows high-deductible health care plans to cover inhalers and nebulizers for treatment of chronic lung disease. There's the connection. Under this provision, patients will receive coverage before reaching their deductible and remain eligible for health savings accounts. For patients with chronic lung disease, lower costs and easier access to these treatments reduces the use of more expensive medical care, including hospitalization. We have a piece of legislation here that uses a proven strategy to help reduce youth smoking and vaping rates while also improving the access and affordability of health care. I look forward to it passing today. Now let me turn this over to a young woman from Kentucky who has been a leader in combating the e-cigarette epidemic in her community, Abigail Hefner.
Hello, my name is Abby Hefner. I'm a 15-year-old sophomore and a straight-A student at McCracken County High School in Paducah, Kentucky. The passage of the Reversing Youth Tobacco Epidemic Act will be a game changer. I'm only sorry that this didn't happen before I tried my first flavored e-cigarette. My story begins when I was at my first ever high school football game. One of my friends had a Juul and offered it to me, telling me it was fun and tasted like mint gum. I tried it, not really knowing what it was or that it might be harmful. I was instantly hooked. My friends and I loved the flavor. It gave me a buzz I had never experienced before. That very same night, I bought my first Juul. Less than a month later, I was using my Juul in the locker room. Later that day, I was escorted out of class by my principal and a resource officer who began to question me about my Juul use. I was scared and ashamed. I knew just how disappointed my family would be. I thought I could stop juuling, but the headaches and withdrawal drew me back. Within a week of receiving my detention, I had purchased another one. Over the course of a year, I would try to stop by throwing my Juul away, only to buy another one. The flavors and a need for nicotine kept drawing me back. I didn't know how to stop. I was too scared to ask my parents for help, and people my age were only making this seem like the social norm. To this day, it is still a struggle not to Juul. My story is not unique. More than 5 million youth now use e-cigarettes, including over 1 in 4 high schoolers. Like me, most of them use flavored products, and many of them are addicted to nicotine. The problem isn't just Juul. The new big thing in my school is disposable e-cigarettes, which come in all kinds of kid-friendly flavors. We must get rid of the flavors that have caused this epidemic. I would especially like to thank Speaker Pelosi and Chairman Pallone for their amazing leadership in the fight to ban flavored e-cigarettes and other flavored tobacco products that have hooked my generation. This day is long overdue, and I'd like to turn over to Chairwoman Bass.
Good morning, everyone. That was very, very powerful testimony. But let's all of us be clear here. We're having this debate today because our efforts to decrease tobacco use are working. From California to New York to the Midwest to the Deep South, ballot initiatives and legislative efforts to curb tobacco use have been extremely successful. In 1988, California voters passed the Tobacco Tax and Health Protection Act, which paved the way for the longest-running comprehensive tobacco control program in the nation. The California Tobacco Control Program chipped away at tobacco use by making it less desirable, less accessible, and less acceptable. In 2016, California passed laws to regulate e-cigarettes and raise the minimum purchase age to 18 to 21. Over time, smoking rates decreased in California. So now Big Tobacco has a problem. They need a new generation of smokers. They need a new generation of people addicted to their product, and they have found a path in a modernistic e-cigarettes and tantalizing flavors like Circus and Twisted Berry. But this is nothing new. Big Tobacco is the king of marketing campaigns, and now they have their sights trained on our most vulnerable and impressionable populations, our youth. And just like before, it's working. Today, 85% of African American adults and 94% of black youth who smoke are using menthol products. If that number is not disturbing enough, smoking-related illnesses are the #1 cause of death for African Americans. When African Americans are disproportionately dying from a substance heavily distributed and targeted to our communities, we cannot sit back and watch people die right in front of us. But we do have to recognize tobacco has done this over and over again. This is just the latest mechanism, the latest scheme. I remember Joe Camel. I remember candy cigarettes when I was a kid. So now we found a new way to hook a new generation because the industry was impacted by all of our community efforts in the past. So I just want to congratulate a new generation of youth, a new generation of activists who I believe will take the lead in stopping the industry from doing what it has done before. I want to thank our leadership for always being in the forefront of fighting for the health of our communities. And I will proudly vote for H.R. 2339. Thank you. I would now like to bring up Dr. Pelosi, is a pediatrician in Washington, D.C., and a spokesperson for the American Academy of Pediatrics.
Thank you, Chairwoman Bass. Good morning. My name is Dr. Lonray Pelosi, and I'm here representing the 67,000 pediatrician members of the American Academy of Pediatrics. I'm also a pediatrician in Washington, D.C., here at Children's National Hospital, and joined by several of my colleagues right behind me as well. I'd like to thank the speaker for inviting me to speak today. So as a pediatrician, I can tell you that e-cigarettes are one of the greatest threats to child health today. This is an urgent epidemic, and we need urgent action. That's why a dozen of my pediatrician colleagues were up on the Hill this week urging the members of Congress to pass the Reversing the Youth Tobacco Epidemic Act. This bill is what we need to intervene, where the regulators fell short, and we need it now. Young people are using these dangerous products at a staggering rate. As you just heard, more than 5 million middle and high school students report using e-cigarettes. They're highly addictive, and what is especially concerning to me is that adolescents are uniquely susceptible to addiction. The teenage brain is still developing, and symptoms of nicotine dependence can appear within days of first use, as you heard from Abby. These products quickly deliver high levels of nicotine, so addiction can happen fast. Adolescents often have no idea how much nicotine they're getting with each hit. In the short term, we've seen compromised lung function, asthma exacerbations, as well as seizures and respiratory distress, but we still don't know the long-term health effects of e-cigarette use, and that should alarm all of us. Pediatricians have seen this addiction in our own patients. We receive frantic calls from parents worried that their children don't know how to stop using. We've even heard of teens who sleep with the e-cigarettes under their pillow at night because they feel they need to vape as soon as they wake up in the morning. E-cigarettes are particularly appealing to young people because of their flavors, like sour apple and mango lemonade. And as pediatricians, we prescribe flavored medicine because it tastes better. But the medicines we're prescribing are good for children, and clearly e-cigarettes are extremely harmful. Adding a flavor to a dangerous product is a recipe for disaster. So this bill would prohibit all flavored tobacco products, including menthol products. And just to highlight what Congresswoman Bass said, the use of mint or menthol reported by high schoolers who used e-cigarettes has increased by 50% in just the last 2 years. In addition, the tobacco industry has a long history of targeting African American communities with menthol products, which has led to disproportionate numbers of Black youth becoming vulnerable to nicotine addiction. Leaving menthol products on the market would only exacerbate these racial disparities and further threaten the health of African American communities. E-cigarettes have been allowed on the market for far too long without any meaningful regulation. We need Congress to intervene immediately and pass the Reversing the Youth Tobacco Epidemic Act. We must approach this public health epidemic with the same rigor and urgency as we do for any epidemic. As long as e-cigarettes remain available for sale in appealing flavors, children and teens will continue to use them. It's going to take all of us working together to address this epidemic, to really stop this crisis, so that children will stop becoming addicted to nicotine. Thank you. And I'd like to yield to fellow pediatrician, Representative Schreier.
Thank you, Dr. Pelosi. Thank you, Abby. And Madam Speaker, thank you for always putting children first. I'm Kim Schreier from Washington State. I'm also a pediatrician and share that passion about our children. I'm also 51 years old, so I remember Joe Camel, and I remember Virginia Slims, and I remember about how the tobacco industry aggressively targeted children because that was their market. They knew that teens were more susceptible to addiction to nicotine and pursued that, and it was a shrewd marketing scheme with disastrous consequences for our kids. And now the vaping industry is doing the exact same thing with flavors like bubblegum, mango, s'mores. This is meant to target kids. It is giving higher doses of nicotine and is addicting them. And rates are skyrocketing. I would say that in the schools of my patients, I see even higher rates than 25%. So we're looking at a new generation of teens addicted to nicotine who will later probably turn to cigarettes. Not to mention that the chemicals in these vaping liquids can do harm in themselves. We can't let that happen. Before I became a pediatrician, I went to medical school. I took care of adults with these disastrous diseases, lung disease, cancers, heart disease, stroke, and we can't send our children down that same path. So when I was a kid, Congress stepped up and did their job. This is our turn to step up to do our job for the children today, to give them a healthier tomorrow. I'm so proud to stand with my colleagues here to pass the Reversing the Youth Tobacco Epidemic Act. Thank you. Congressman Dr. Ruiz.
Good to see you. Good job. Isn't she wonderful? Pediatrician. Amazing. Thank you, Speaker Pelosi, and trust me, I'm an emergency medicine doctor. When I get a sick child in the emergency department, I am praying for that pediatrician to come down and work with me to resuscitate and to really take care of the patient well. Thank you, Speaker Pelosi, Chairman Pallone, Chairman Neal, and all the members who are here today for their tireless work to keep our young people safe and healthy. And a special thank you to Abigail for your courage and your testimony. Testimonies are much more powerful than any policy conversation. And Dr. Pelosi for sharing your stories and perspectives. My name is Dr. Raul Ruiz. I'm an emergency physician trained in humanitarian and disaster aid and public health expert. And I represent California's 36th congressional district. As a doctor, I am all too familiar with the devastation that addiction to nicotine can cause. I see the patients in the emergency department gasping for air with COPD. I see the patients coming in with life-debilitating strokes. I have seen firsthand the health decline in patients who tried nicotine as teenagers, got addicted, and never quit. Let's be very clear. there are three parallel conversations when we talk about vaping. The first conversation is about the acute respiratory distress syndromes, where you see the fibrotic changes, and you saw the stories of children going into the ICU and having to require a lung transplant. That's mainly because of open sources of vaping material and people mixing THC, vitamin E, and other chemicals that damage the lung for life. That's one issue. Then we have the other issue of the whole conversation of whether vaping is safe. No, it's not. Whether there's a public health benefit. No, there's not. So then there's the third issue, which is the youth epidemic, the amount of youth who are buying legitimate packages, right, from the stores and then getting hooked on nicotine. And that's what we're talking about here. The number of kids using these products is disturbing to me as a member of Congress, as a physician, and as a parent of two 4-year-old twins. From 2017 to 2019, e-cigarette use doubled among high school students and tripled among middle school students. Siri, let me explain. There are over 5 million kids using e-cigarettes today, an increase of 3 million in just 2 years. And the health effects of this are real and dangerous. You see, cigarettes are the deadliest form of tobacco, no doubt about it, but no tobacco product is safe. Vape aerosol contains some of the same chemicals found in cigarettes. Smoke, chromium, formaldehyde, lead, nickel, and tin. Nicotine use changes adolescents' brain cell activity, affecting attention, learning, behavior, and memory function. And research shows that you're more likely to start smoking cigarettes if you vape. And that's primarily because using nicotine at an early age means you are more likely to be addicted to tobacco products for life. And what is so shameful about the tactics employed by companies purposely targeting youth with these products is that they know if they get a kid addicted, they have them for life. That is why it is so important that we work to address the youth vaping epidemic immediately. H.R. 2339, the Protecting American Lungs and Reversing the Youth Tobacco Epidemic Act of 2020, will help us reach that objective. This bill takes a comprehensive, science and medicine-backed approach to address this epidemic and prevent an entirely new generation from a life of nicotine addiction. It does so by prohibiting companies from marketing e-cigarettes to youth under 21 and prevent online sales of e-cigarettes, which is how many kids get their hands on these products. The legislation also includes a provision from my bill, the No Vape Act, to crack down on retailers who sell these products to underage youth. It is my job as a public health expert, and it is our job as members of Congress to ensure measures are put in place to prevent more Americans from getting hooked on nicotine at an early age. So thank you to everyone who worked on this bill. Thank you once again to Abigail for your courage and telling your story, and I will turn it back to Speaker Pelosi.
Thank you very much, Dr. Ruiz, Dr. Shriver, Dr. Pelosi, to Abby, to our colleagues, to Chairman Pallone, to Chairman Riccinio. I also want to acknowledge the work of Tom Swazi, who put the tax piece into this bill. And to Karen Bass. Karen Bass has been like a guardian angel to children, foster kids just at every aspect of their lives where public policy has an impact. She has been a complete champion, in fact, has created more opportunities for public policy to weigh in. They all had to leave to go to the floor, as do I now. But since Congresswoman Bass, Madam Chair Bass, mentioned the California law, I will tell you this experience we had in San Francisco. Jewel put an initiative on the ballot. It was horrible. It was horrible. And they made it sound as if it were something that was going to protect children. They completely misrepresented. I wish I had some of the mailers I received at my home about how this was going to prevent kids from smoking and the rest. Total misrepresentation, total enticement for kids to be hooked on nicotine. They were not protecting children. They were a path to addiction. So they're not playing it honest in terms of what they are presenting. And today we want to bring reality to the floor of the House. If we're serious as we weigh the equities about what's this and what's that, and could it have been done better or this or that, let us weigh the equity in favor of our children. And we thank our guests who made this the case so clear scientifically, by personal experience. Thank you, Abby, for your courage to do so. And to all of these beautiful children of the Campaign for Tobacco Kids, thank you for honoring us with your presence, and the docs who also joined us. Thank you all very much. Now we have to go to the floor and make this happen. Thank you all very much. Good morning.
I do.